Alrighty, so this lesson is actually going to be quick. I did the entire lesson, 49 minutes to be exact, and I did not realize I was muted the entire time until I got a message that there was no sound. And then I realized I never unmuted myself. So I'm going to do a shorter version of this lesson than the one I did before. I'm definitely still going to give you all of the information that you need. I just will do it quickly. Most of the information in this lesson you do have to know for the Certified Medical Administrative Assistant exam. Also, for those of you that's going on to medical assistant, this is the type of lesson that is needed across the board. So whether you're on the administrative side or the medical assistant side, both certifications covers appointment types. Okay. All right. So let me go ahead and get started. So again, because I just went through this entire thing, 49 minutes, I'm going to kind of go through this quicker than I did before. Let's see. I'm going to just go ahead and read this introduction here. Responsibility for scheduling and managing the flow of patient care in a medical or clinic is one of the most important duties assigned to a medical assistant. As appointment manager, you make the first, last, and most durable impression on the patient and providers. So just remember that you make the first impression. So just think about how it is when you go into a doctor's office, especially for the first time. Think about what forms your impression about that office right away. And so just think about that as the medical professional. All right. And they say that the appointment schedule is the heart of the office because it allows things to run smoothly. If we didn't have a schedule, things will be hectic. It will be all over the place, right? So that's how important scheduling is to the office. There have been times where I've had a co-worker who was doing the scheduling, never hit submit or enter or whatever that last step is to put the appointment in. And then we had patients showing up with their appointment card. Okay. So, we had to see that patient because we gave them an appointment card. We were putting in the appointment, and for some reason, it never got submitted. Okay. And because that's our fault, we have to see that patient. All right. So for those of you that's in this scheduling position, it's just so important to be mindful. Just double check and recheck. Okay. Now, providers are healthcare workers who deliver medical care. All right, so it's a couple different ways of scheduling. You have manual and then you have electronic. So manual, you will use an appointment book, and we're going to look at an example on the next slide, okay? So on the appointment book, you want to make sure you have enough space to write in everything that you need to. And it is, on most appointment books, it is very small. So you got to kind of make it work. You'll see what I mean in a moment. Now, most places don't use the manual and appointment scheduling system anymore. However, there are probably some older physicians that still maybe do things the old-fashioned way. And maybe, you may work in a place where they use the appointment book, but also use the system. I have worked in a GYN office. It was a small office who operated like that. They used the appointment book, but also the electronic health record. They just wanted, both just in case the system ever went out, because that's one of the disadvantages of having the electronic system is that if the system goes out, power outages and things like that, you have no way of knowing who's supposed to come in. Okay. All right. So this is an example of the appointment book. And the very first thing that you want to do, well, let's look here. Let's look at the different doctors up here. This is Dr. Jones, Dr. Smith. Looks like this is kind of blurry, but it looks like it says Dr. Stowe. And then it's the lab schedule. This is for people who just needs to come in and get blood work, right? So, and this is funny because I worked with both a Dr. Jones and a Dr. Smith in the same office. But notice their unavailable times are X'd out. So this is the first thing you start with when you get your appointment book, right? You want to always, each day, you want to cross out the unavailable times first because you don't want to start scheduling patients in the times where they're supposed to be unavailable, right? So this is Dr. Jones is probably not here at this time. This is the lunchtime. This is when Dr. Smith is off. And notice Dr. Stowe is doing hospital rounds, okay? So it's very important to indicate those unavailable times first, and then you go to schedule appointments, okay? Now, let's look at this one real quick. between 9 and 10. This is a 1-hour appointment here. See this little arrow there and this information here? You want to write as much information as possible, right? And so sometimes you may shade in those areas just to indicate that this patient gets this entire hour, or in this case, they wrote in the phone number, the reason for the visit, and then the arrow to indicate that this person has this entire time slot. So they're probably a new patient physical for this. Let's see, I can't see. It looks like it says CPE, which is complete physical exam. So this is why this patient has an entire hour. And then if you need just 15 minutes, you would only get one line, because from 10 to 10:15, that's your slot. Once you start going into the next line, you're taking up another appointment slot. And we can talk more about this later. But let's go ahead on to the electronic health care system, computerized appointment scheduling. So this is how it looks. This is much more simplistic, right? Because you're entering the information, it's automatically going to populate the amount of time that the patient needs. Like in this case, they have 45. This is a 45-minute visit, right? It says established patient, sick visits. Sick visits is visits outside of physicals and well checks. So it doesn't necessarily mean the patient is sick. Like this is a diabetic consult, okay? And like I said, sick visit is anything outside of the well check. So it doesn't necessarily mean the patient is, sick, like, had vomiting or stomach ache or anything like that. It just means that this is a regular appointment, 45 minutes. Established patient means that the patient was seen before. The advantages of this, like I said, is that it's very simple. You can easily print it out. Disadvantage, as I mentioned earlier, when the system goes out, that's it. You can't, until it comes back up, or unless there is a backup system available, there's nothing we can do, and then we have to use the paper charting system. All right, establishing the matrix. This is very important. The matrix is a system for blocking off unavailable patient appointment times. This is exam material. This is definitely something you need to know. You may see something like, what is the purpose of a matrix? It's a system for blocking off unavailable time. So remember, I told you, when you get that appointment book, or even on an electronic system. Now, as a medical office professional, on an electronic system, usually it's already built in, like they already set a template for it, so you don't have to go in and cross out the unavailable times. But on a paper schedule, you do have to go in and cross out those times. So that's what the matrix does. That's the system for blocking off those unavailable times, and then you can begin to schedule, okay? And like I said, you want to cross those times out, and then you'll include the reason. So lunch, meeting, off for the day, hospital rounds like we saw in the example. And you also want to make sure each of the staff has a copy of the schedule. The purpose of a matrix: block off unavailable times, okay? All right, so structured appointments. So buffer, that's the extra time that you have, maybe first thing in the morning, to do things that you need to do, right? Pulling your charts, returning phone calls, anything that is not as easy to do once the patient start rolling in. That is considered your that is what your buffer time is for, right? So if your first patient is seen at 9, you all may be scheduled to come in at 8:30 or even 8 o'clock if you all have an hour buffer time, right? All right, so this is the most important part of this lesson, the appointment types, okay? Now, pay close attention to these appointment types. Make sure you take notes, because this is exam information. If you have any questions after this, as always, feel free to ask me, all right? Now, clustering. This is the first appointment type that we're going to talk about. Clustering. Think about clustering is what? A cluster is a group of something. So another word for clustering is grouping. So you may see grouping appointment types or clustering appointment types. That is when people that's coming in for the same thing, or have some of the same needs come in at the same time, right? So let's say you work in a family practice office, and the doctor you work for, she or he sees all of their physicals on Monday, Wednesday, and Friday mornings. That's an example of clustering your appointments, okay? Let's say they do all of their follow-ups on Tuesday and Thursday afternoon. That's an example of clustering, right? Let's say they see all of their what's another one? Pediatric appointments, right? Let's say you work for a pediatrician and they do all of their well child visits Monday through Friday from 8 to 12 p.m., right? They only do those type of appointments on Monday through Friday in the mornings. The afternoons are for follow-ups and things like that. That it is an example of clustering, okay? The similar patients with similar needs are scheduled on the same days or in the same time frame, okay? Wave scheduling. Now, this is the one that kind of gets confusing for people because there's a wave and then there's a modification to it called wave scheduling, okay? Now, wave scheduling is when, well, let me ask you this. Have you ever went to your doctor's appointment and you signed in, your appointment is at 9 o'clock, and you look at the sign-in sheet, you see the names above you, you see one or two other names that's also scheduled at 9 o'clock for the same doctor, and you wonder, why are they also scheduled at 9 o'clock? That's because that office may be using the wave scheduling system. And that's when they'll schedule several patients at the top of the hour, right? Like, so all three of you are scheduled at 9 o'clock, and then they'll just see you as you arrive, okay? And the rest of the hour is left open. So the second half of the hour is left open for whatever the doctor needs to do. So emergencies, catching up on charting, phone calls, or whatever. So that's wave, okay? Several people are scheduled at the first half of each hour or at the top of the hour. Example, all of you all are scheduled at 9 o'clock. There is nobody else scheduled at 9:30, 9:45, right? You all have that entire hour to the doctor. For the doctor has that entire hour to see you and do other things. And then they see the patients in the order that they arrive. Okay, so whichever 9 o'clock comes first, they'll see them first. Okay. Now, modified wave. Let me go back. Modified wave is when example, one of you may be scheduled at 9, and then one of you may be scheduled, and then the other two may be scheduled at 9:30, or vice versa. Two of you may be scheduled at 9, and then the other person is scheduled at 9:30. That is when the doctor, he still only has those three patients scheduled within those hours, but it's spread out. They're all through the hour. So let's say the appointments are 20-minute appointments, right? Um, Two of you may be scheduled at 9:20, and then two of you may be scheduled at 9 o'clock, and then one of you may be scheduled at 9:20. If it's 30-minute appointments, two of you may be scheduled at 9, then the other one is scheduled at 9:30. Okay. So again, if you have any questions, feel free to ask me about it. But I'll just kind of recap. Wave is when several people are scheduled at the top of the hour. The rest of the hour is left open, right? All three of those patients are seen within those hours. The modification to the wave, which is called modified wave, is when the patients are scheduled throughout the hour. Okay. Um, and in this example that is given, full physicals on the hour, this is an example. So they may schedule the patient for a full physical, which is a 30-minute appointment, or maybe even 45 minutes, depending on the office. So the physical, that one person for the physical may be scheduled at 9 because they need 30 minutes. And then rechecks, like a blood pressure recheck or a finger stick recheck, can be scheduled at 9:30. So the physical, the long appointment is scheduled at 9, and then the shorter appointments are scheduled at 9:30. Okay. So that's wave and modified wave. All right, fixed scheduling, also called stream scheduling. This is the most common method. Okay, so this is this is the type of scheduling that you're probably used to when you go to the office. Like if you're going for a physical, you may be scheduled for 30 minutes, or if you're a new physical, 45 minutes or an hour. Follow up, maybe 15 minutes. Okay. With this method, patients get the amount of time depending on what they're coming in for. Okay, so the time is allotted by the complexity of the problem. All right. An example is 9 to 9:15 for a follow-up appointment, or maybe a sick visit, patient has a headache, or 9:30 to 10 o'clock for physical. Okay, so that's fixed scheduling, also called stream scheduling. Double booking. All right. Now, double booking is not the same as wave. So remember we said with wave, those 3 patients are all scheduled at the same time, but the rest of the hours left open. With double booking, that it's not like that. With double booking, those 2 patients are in the exact same slot with the same doctor. However, that doctor still has a 9:15, a 9:30, a 9:45. So this is really considered poor practice. This is something that we only do last resort, or let's just say a patient walks in and she or he just needs like a talk to the doctor real quick for a refill. They were just seen recently, so they don't need an entire workup. They just need to get a refill really quickly, or a follow-up blood pressure check or something. The doctor may say, go ahead and add Miss Smith on to double book her at my 9 o'clock. So usually it's for something quick. So that's the difference between double booking and wave, because sometimes people get wave mixed up with double booking. But remember, with wave scheduling, you have that the rest of the hour open, so that way the doctor can get caught up. With double booking, the doctor can actually go, off schedule, because he's double booked and there's no other time allotted to catch up. Okay, like it is with wave. All right. Flexible hours means it varies throughout the week. Now, the doctor may be open 8 to 4, Monday, Tuesday, Thursday, Friday, and then Wednesdays are the late days. They may open at 11 a.m. and close at 7 p.m., or maybe they're closed on Wednesdays, so that way they can open on Saturday. So that's an example of flexible hours, meaning it just they vary throughout the week. The time is not the same every single day. Open hours, you all, I'm sure, are familiar with that. That's your walk-ins, right? That's like urgent care centers, and even at the doctor's office, when they have those walk-in days or walk-in hours, patients are seen in the order that they arrive. They can arrive at their convenience. They may be seen according to the complexity of their problem. Like, for an example, a patient that has a headache will not be seen before the patient that's coming in with chest pain, right? So they're triaged. They go through a process called triaging, which means that the nurse is determining who needs to be seen first. Okay. Okay. 3 systems that can be used for scheduling patients. You got scheduled appointments, right? Flexible hours, and then open hours. So good communication is critical. We talked about that before. Emotions can make slight miscommunication into negative experiences for the patients. Okay. All right. So let's talk about the difference between an acute problem and a chronic problem. So an acute problem is something that just happened all of a sudden. So if a person has acute chest pain, that means that it just came on all of a sudden. Chronic means that it's long standing. So let's say a person has chronic high blood pressure. That means they have long standing high blood pressure. It's ongoing. Or chronic chest pain. That means they deal with chest pain regularly. Maybe they have acid reflux and constantly have heartburn. You know what I mean? Or what's another one? Maybe chronic migraines. Okay. That is something that is ongoing. So it is good to collect that type of information when you're making appointments, to find out, is your issue, did it just start, or is it something that's been going on? Okay. Um, and again, I'm just kind of going through this because, like I said, I spent about 49 minutes on the last recording. So I just want to kind of get through this a little bit quicker than the first time. But providers' preferences and needs. Okay. The more you work with your doctors, the more you'll learn what your doctor wants and what your doctor prefers. For an example, sometimes you may have a doctor who, moves pretty quickly. Like, you already know they're in and out the room. You don't have to worry too much about them. But then you have doctors that move slower. Like, we've had doctors, when I worked the last office I worked in, the cardiology office, we had one, he was in and out. Dr. Smith was in and out. Then we had another doctor who took forever. And we used to literally have to knock on the door sometimes to remind him, like, look, you got other patients out there. And so, you'll start knowing your provider. You'll start knowing their preferences. Like, some doctors, they don't want you to bother them at all once they're in the room with a patient. Do not knock on the door unless it's a life or death emergency. Some doctors, they won't mind you knocking on the door if there's a phone call or if you have a question. Okay. So the more you work with them, the more you'll know your doctor. Physical facilities. So this is this refers to Let's just say you have let's say you work in an office where it's multiple, where's multiple, you work for a practice where it's multiple offices, right? The cardiology practice I work for, we had 4 different offices, but only 2 of them did nuclear stress tests. Okay. So knowing this, we had to only schedule those patients that need a nuclear stress test. We could only schedule them at those 2 locations. Okay. And even within those locations, we needed to know which room to put them in, because if you need a certain instrument, or if you need certain equipment that's in certain rooms, you got to know, okay, they got to go to this facility, and then the clinical medical assistants, they'll know which room I can use. Some rooms you can't even use for exams because there's no sink in them. All right, so this is what this is talking about, just knowing your facility and knowing what facility you can use and also which rooms you can use. Always be pleasant and helpful. Always include the patient phone number on the schedule. Why? Because the phone number you have on file may be incorrect. When it comes time to confirm the appointment, or even if you have to cancel it, and the patient has changed their phone number, we have no way of reaching them. So we have to confirm their phone numbers when we're making the appointment, and we want to put the phone number in the patient's appointment slot. Okay. So new patients, we got to give them time. Okay. We have to get them to come in early. Okay. To fill out paperwork. When we're on the phone with them, we want to collect as much information as possible. All of this information you want to get, including the third party payer, which is the insurance company, right? Explain the financial policy. What happens if they no show? How much will they be charged? If they're a self-pay patient, how much would they be responsible for? At that office, the cardiology office I worked for, if they were self-pay, we let them know that they had to pay at least $100 before they could be seen, right? The visit would eventually be more than that, but that was just in order for them to even go back to the room, we had to collect $100 as they were checking in. So explaining that type of information, and that's also something that you will see on the test too. It'll say what is something that you absolutely have to explain to a patient, and it's the financial policy. Even though there's other things, the other options that they'll give is going to be things that you will, but it's going to say like absolutely. So, we'll see questions that's going to have those keywords. What is something you absolutely, like more than anything, need to make sure you tell your patient? And this is one of those things. All right, make sure they know the location and the directions. Ask if we can leave messages to confirm their appointment on their home voicemail or at work, okay? And make sure we reconfirm the date and time, and make sure that it's entered correctly, so that way, we don't have a situation where the patient is showing up and we did not enter the appointment correctly. Note if a referral is needed. So if a patient has a certain insurance that requires a referral, we have to make sure we have that referral. Why? Because if we don't and that patient is seen, that insurance company may deny that claim, okay? And that means that the doctor won't get paid, okay? So we have to make sure that the referral is on file if they need it. Established patients. Established means that the patient has been seen before. So just like new patients, you want to make sure you enter in everything correctly, okay? If they're present, just give them an appointment card, meaning they're checking out and they make their appointment, just give them their appointment card, okay? For the schedule, just make sure, like I mentioned earlier, you make a copy for the staff, put it on the doctor's desk, okay? So that way they'll have the schedule. All right, so appointment cards, you always want to make sure you give your person an appointment card, your patient an appointment card, okay? Telephone reminders, this is the old-fashioned way. Back in the day, we used to have to pull the schedule and sit there and call the entire schedule, pick up the phone and call each person to remind them of their appointments. Now, well, this is the mail reminder cards. We don't use as much because sometimes the appointment is so close that it wouldn't get to them in time. But this is still an option if you book out further enough to where this will get to them. Or if you have some new patient paperwork they need to fill out, we used to do that as well until it got to a point where we can have them printed from the website. But this is more, this is an option that is kind of rarely used from my experience anyway. But I was going to say, now we have the electronic reminders. We have email and even text messages now, right? Patients have to opt in, so we got to get their permission first, right? We're not going to use slang in the emails or the text. We're going to be professional, and we're going to maintain confidentiality. So we're not going to point out in the text message what they're coming in for. All we're doing is, confirming Mary Smith, confirming your appointment for such and such date. Okay, we're not going to say for your STD check or for your well woman exam. We're just going to say, confirming your appointment. Emergencies, this is a big one. So sometimes you're going to have emergency calls. Patients are going to call, and there are going to be times where you're going to have to direct them to call call EMS, call 911, or have someone to take them. Something like chest pain, tell them right away, call 911 or have somebody take you to the hospital. It's best to call 911 so that way they can get there and do whatever they need to do if a heart attack or stroke or something like that is happening, right? So stat means immediately. That means right away. If a person needs to be seen stat, that means that needs to be seen right away. And then this is some things you can screenshot this. This is some things you want to look out for. If the patient has any of these complaints, they need to be seen now. They need to be seen right away. Okay. So look out for these type of symptoms. Go ahead and screenshot that, or take a picture of it. So constellation of symptoms. That means that the patient has a group of things, a group of symptoms that's indicating something serious. For example, heart attack. If a person has shortness of breath, chest pain, arm and neck pain, nausea and vomiting, that can indicate a heart attack. Now, shortness of breath by itself or nausea and vomiting by itself, that's not necessarily a heart attack. But when you have it in combination to other things, that can indicate a heart attack. Severe right lower quadrant pain, nausea, and fever, that can point to appendicitis. So when you have somebody with a group of symptoms like this, that is an emergency and a person needs to be seen right away. Patients who are acutely ill, severe but not life-threatening, meaning they may have something that is urgent to where they need to be seen today, but they don't necessarily need to call 911, right? Like maybe they have blood in their stool. That's something that's serious. It's urgent, but it's not necessarily life-threatening. I mean, it could, bleeding in stool can indicate some internal bleeding. So it's not that it's not urgent, but they don't necessarily have to call 911 right then and there, but they do need to be seen. Obtain as much information as possible, and then place a note in a chart for the physician to review it. All right, so walk-in patients, late patients. These are some of the type of issues that you may have to deal with. Patients walking in, there should be a policy in place, right? Some doctors, like I said, you'll get to know your doctor preferences. Some doctors will, they'll work certain patients in, but the patient, we just have to let the patient know that they would need to wait, okay? We'll try to see you, but you may need to wait for a few minutes, okay? Late patients, the patient come in late, they'll need to wait to the end of the day, or we may not be able to see them at all. It all depends on the doctor. We'll always ask our physician what they want to do. If they want to go ahead and see the patient, we'll go ahead and let them know. Either way, it's going to be a wait. Patients who are chronically late, we tend to start scheduling them towards the evening anyway. Late patients, like make them the last appointment. Sometimes the physician is delayed, maybe they're behind, or maybe they're coming into the office late. We have a duty to let our patients know, give them the right to decide if they want to wait or if they want to reschedule. Okay. If we already have patients in a waiting room, we let them know, hey, the physician is running behind. Just letting you know. Would you like to wait or reschedule? All right. Always keep the patients informed. So missed appointments. All right, so this is a big one. No shows. Patient fails to show up for appointment and does not call to notify. Call the patient to determine the reason and to reschedule. All right. So and that's you. It depends on your doctor. Your doctor may want to, depending on what kind of practice you work for, they may or may not have you do this. But if you're working somewhere like cardiologist or like somewhere where they follow their patients closely due to their um, due to the nature of their relationship with their doctor, why they see that doctor, you may have to call. But some doctors you won't have to call to find out. the patient will eventually call back and reschedule, but they'll be charged a no-show fee. Chronically, patients who chronically no-show, they can be terminated. Their relationship can be terminated. Remember, we talked about abandonment and the doctor being able to be sued for abandonment, right? In a situation where the patient constantly no-shows, that physician has the right to terminate that patient, all right? If they're constantly, because those are appointment slots that could have been taken by somebody who really needed it. This is an example of charting. So this is an example of a patient missing their appointment. And remember, we talked about document, document, document. If it's not documented, it is not done, right? So if a person missed an appointment, some type of conversation happened, whatever, you want to always document, 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 okay? And then you'll sign your name and then your credentials. Cancellations by the office. There's going to be some times where your doctor's going to have to call out if the physician is ill or if they have an emergency. So I worked for a doctor who, she was family practice, but she also delivered babies. So there would be times where her patient would go into labor and she had to cancel. So you let the patients know, I'm sorry, the doctor had an emergency. We'll need to reschedule your appointment. Now, in some situations, if there's other offices, if there's other physicians or providers in the office, then they may be able to see another doctor. Otherwise, they will have to reschedule. Cancellations by the patient, and this is the best way. If the patient call in and cancel as opposed to no showing, just make a note, reschedule them, right? And if it's an ongoing problem, emphasize the importance of keeping their appointments, okay? Keeping their appointment. Now, can schedule move up list patients? Move up list patients, that's in other words, a waiting list. So some offices have electronic wait list where, let's just say you add a patient to a wait list, somebody cancels, you'll automatically get a notification, hey, Murray Smith is on the wait list. And then you can call Mary Smith and tell her she can come in today if she's available. You know, out 11 o'clock, cancel. Would you like to come in today at 11? Referrals and consultations. I kind of mentioned a referral earlier. We'll get more into referrals when we get to the insurance part. But again, some insurance companies require a referral. You must make sure you have it. They need it. Sometimes you will even get them to send a referral over before you will even make the appointment, depending on your office, okay? This is anytime a patient is going to a specialist. If their referral requires that if their insurance requires that they need a referral, you have to make sure you have it in hand before that patient is seen. Now, some insurances, a patient can just go straight to the specialist, and you'll know as you're out there and you're dealing with these insurances, you'll know which insurance company needs a referral and which insurance company does not need a referral, okay? And this is an example of a referral. The referral will indicate the patient's diagnosis and any other notes that the doctor needs to include. It'll also have their information as well as the doctor that they're referring the patient to. And this is just some information of what you need to do if you ever have to call a physician's office and make the appointment for the patient. You'll give them the patient's information, the reason, how urgent it is, insurance information, and then you'll just record it in the patient's chart, who you talk to. You'll also give or mail the referral to the person. Okay, so that's just indicating that. Diagnostic testing, remember we talked about diagnostic testing before. Think about diagnose. So diagnostic tests, those are tests that are done for the doctor to diagnose. So like labs, radiology. So sometimes you may have to schedule those appointments for a patient. Things like chest x-rays, usually a person can just walk into a radiology department for that. You want to make it while the patient is still in the office. If it's stat, you got to indicate stat on a referral. That means that it needs to be approved right away and that they need to be seen right away, okay? Some lab studies and x-ray require advanced preparation like fasting. Sometimes you may have to fast before certain tests. Sometimes you may have to hold certain medications before tests, or sometimes you may can eat, but it's only a liquid diet. So you got to make sure you give those written and verbal instructions, right? Make sure they understand, document it in a chart and put it in a tickler file. Now, this is another one of those terms that I mentioned is going to be on the certification. So tickler files are reminder files. So we'll talk again about this later, but just a note right there that tickler files is something that you will see a question about, and that is a reminder file. So if we have to remind, if you have to remember to remind the patient about something, you will put it in a tickler file. And we even use tickler files for the office for day-to-day tasks. We may use a tickler file to remind us of things. Surgery, we're going to talk more about this pre-certification when it comes down, when we get to the insurance part, so we won't go too much into that, but sometimes you may have to do pre-certification and get the procedure authorized prior to the patient showing up to the hospital, or the physician we're referring them to. Let's see, give patient copy of pre-admission forms. Oh, that's if the patient needs to be admitted. So there may be procedures where you have to pre-admit the person. Now, if it's a procedure where it's in and out and they don't need to be admitted, you don't have to worry about that. But this is in a case where the patient has to be admitted, okay? What information should be readily available when calling to schedule a patient for surgery in another facility? That's going to be the demographic information and insurance, the patient's name, address, phone number, diagnosis, the surgery that's planned, and any special instructions like fasting or any of those things, okay? And then actually, this is the last slide. So this is going to be the end of this lesson. Again, I kind of had to go through this really quickly. I realized when someone messaged me that the first lesson was completely muted, all 49 minutes of it. So this is the recording. I kind of had to go through it quickly. If you have any questions, of course, as always, let me know. Send me a message, okay? And I'm going to go ahead and start recording this.